Hello, everybody. I am Dr. Umesh Patel, a cardiologist in Covington. I have been invited to talk to you all about dysautonomia. Just in the way of background, I know there's a diverse audience, so I don't know who knows me or not, so I'll just explain a little bit about what I do in my training. I was educated in Africa, in Nairobi, and then in London at University of London, where I also did a 5-year residency in family medicine and got other certificates in of OBGYN, etc. Then I came to Tulane and did another 5 years of internal medicine and cardiology, and subsequently went into private practice. Over the years, I have seen many patients who have been through various specialties and physicians, and um, they seem to be looking for help and answers. And it was frustrating initially, but eventually, after doing my own research, I figured out that there was a common denominator: the autonomic nervous system. This system is your master control. It controls every organ system in the body, and essentially it's located throughout the body because it controls every cell, every organ. In the basic form, there's two parts to it. One's the part that makes things go fast, which is called the sympathetic nervous system, and then there's the other part that's called the parasympathetic nervous system, which slows things down. There's actually a third one, which is the autonomic nervous system, which kind of combines the two. And the main control sits in the brain, although there are secondary centers through the body. So one can imagine when this system, which is running your entire body, is not working at its best, then either the organ system doesn't work right or the person just feels awful. To illustrate that, a lot of patients with this have episodes where they get dizzy or weak, can't function. And what's happening is that there's not adequate blood flow to the brain. And that occurs because normally when we're laying down, plenty of blood gets to the brain. The body is not fighting gravity. When we stand up or sit up, blood drains through gravity towards the lower body, and the autonomic nervous system is tasked to immediately restore the flow. And that can be delayed in some patients to the point where brain functions start going off. So various signals start occurring, such as feeling dizzy, blurry vision, maybe not being able to hear. You can see people talking to you, but you can't talk back, or even passing out. And so the autonomic system is very important to the brain, but also to other organs. So it will affect everything from your hair, your glands, your pituitary, thyroid, heart, the lungs, causing trouble with breathing, the stomach, diarrhea, constipation, bloating, abdominal pain, pelvic organ function, having to go to the bathroom a lot to urinate, burning, the joints aching, muscles aching, tingling, numbness, etc., all the way down to your legs where you get blotching, cold feet, cold hands. All these are autonomic symptoms. This is not an inclusive list. There's a lot of things that I haven't said. But anyway, diverse as it is, the key for most patients is to be seen by the physician so they get checked out, make sure there's nothing actually wrong with the organ system. For example, if you're having chest pain, just to make sure there's no blockages causing flow of blood to the heart. But generally, when all that comes back negative, then what do you do? So your doctor may send you to other specialists. And finally, usually after 6 or so specialist consultations, the patient may arrive at a physician who specializes in autonomic dysfunction, and that's where the light bulbs start going off. And I'm happy to say there's a great little book I recommend to everyone to read, and it takes 10 minutes to read the introductory chapter. It's called the Dysautonomia Project. The folks who did this have collaborated between patients, nurses, caregivers, physicians, experts, etc., created this masterpiece where on the left side is in plain English for patients and their families, and on the right side it's for the physicians and nurses and pharmacists, whoever cares to delve into the deeper workings of the autonomic nervous system. I've gone through lots of books and lots of recommendations to our patients over the decades, but this one is literally the one. I almost call it required reading. If you want to get ahead with your condition, you better read this, and probably read it every 3 to 6 months, because you will pick up little tidbits which you have missed. So remember that one. Of course, there's the websites, Dysautonomia Louisiana, EDS Louisiana Inc. And the reason I mention that is we have a lot of patients from both those groups who are participating today. And I do want to thank Carmen Gonzalez, who essentially runs the Louisiana Dysautonomia group, and April Torres, who runs the EDS group, for inviting me, because I wanted to spread the word that you guys are not alone. There are a lot of sufferers, and actually these two Facebook groups are awesome in providing support to each other. And I really don't get on them, but as you all know, sometimes I just can't help myself, and I want to give everybody the benefit of my knowledge, and I'll post something on my Facebook page. So it's just all about sharing information, so patients and their families and doctors can better understand how to treat this. Now, my favorite thing to tell patients is, number one, you're not crazy, because after you've been through 6 or 10 specialists, maybe over 10 years, you start doubting yourself. Don't. You are actually suffering these conditions. It's not in your head. Your body is signaling back and forth and giving you the symptoms. So you might feel like you're fatigued all the time, or you have your no volition, your memory's poor, can't do what everybody else does. And this might be intermittent, and you may have odd tingling, rashes, hives, things that, quote, quote, other people have never heard of. Well, I've heard of them all. I have heard so many unusual symptoms. And when you have an open mind and you integrate that to the medical knowledge behind the process, it becomes very obvious. These things are autonomic symptoms causing, causing signs, and the patient is definitely not making it up. They do not want to be sick. So please reassure yourselves that you're not trying to be sick, you want help. And just harking back to those two support groups, there's one I recommend for even the dysautonomics to go to, is the EDS Louisiana Inc. Facebook group, because they have a score there called the Byton score, which you can self-score, and just to check if you have what we call hypermobility joint syndrome, because oftentimes that's why you're having so many aches and pains. At the there's a whole spectrum of that. So what happens is that some patients is just the joints are a little bit more achy and mobile. Others have the full-blown hypermobile Ehlers-Danlos syndrome, where the tissues are uh, easy to stretch, so the joints will stretch out more than they should, and they never quite go back to normal. So that injures the joints, and lo and behold, chronic joint damage, joint pain, and so on. So it is really important to know if you have that, so you don't damage yourself trying to exercise so much that you actually make the damage worse. So it is important to know if you do have a little bit of that. Uh, a lot of the EDS patients actually have autonomic issues too. So it's a kind of a crossover. Of course, there's fibromyalgia, very common. A lot of patients will also describe this aching in their shoulders and back. That's called the coat hanger distribution of discomfort. And it's coming from both the fibromyalgia as well as the decreased blood flow that the spinal nerves are getting when the patient's autonomic system is not maintaining blood pressure to the upper part of the body. So it's not just the brain, it's also the spine. And the spinal arteries, which supply all those nerves down there, are actually seeking help. They're saying, we need more blood up here because we can't function, and that's why you get that pain. So on to diagnostic testing. Frankly, the best test is a physician who will sit and listen to your symptoms and then be able to say, oh, this sounds a bit like dysautonomia, and that's the first step. The other things are more of a confirmation. And remember, testing is not always going to be black and white. There are many shades of gray. And unfortunately, in the medical world, insurance companies, etc., we've all been trained to believe numbers rather than our own brains and intellect. So you have to forgive patients, physicians, everybody, practitioners, from looking at information on a piece of paper and declaring you either have or have not got a symptom, a condition like dysautonomia, hypermobile syndrome, and whatever. So just remember, you are the dysautonomia, EDS population, and all the subclasses tend to run on the outer edges of normality of what we as physicians call normal values. And oftentimes, you run there all your life, and unfortunately, for example, you might have low white cell counts. And that's actually the way the bone marrow is programmed. The autonomic system is telling it this is normal, and everybody around you is wondering why your white cells are low. And of course, they're worried about leukemia and things like that. But really, when you watch these over the decades, they don't change. And that tells you that that is normal for that patient. So similarly, this occurs in patients with pain medication. Pain sensations can be either very sensitive, hypersensitive, or they can be low so that the patient doesn't feel pain. Oftentimes, pain medicines don't work well, and there's actually a genetic reason. There's a whole science called pharmacogenetics, which looks at how the genes program the processing of drugs, which makes you either metabolize them and use them up real fast, or let them hang around so much that even a tiny amount of medicine can have effect for days on end. So it is just an amazing field, and it takes a lot of patience and time to realize that you're not alone and these things are happening to you. Just a few words on what you can do to help yourself. Just basics: hydration, water. Water makes up the most of your body and your cellular structures, and you've got to be hydrated well. Some people find it hard to remember, so you've got to have a calibrated cup which reminds you that, oh, you haven't had enough water that day. The other thing you need is electrolytes. And usually salt will do it, but I usually recommend other products, some such as Vitasium, Noom, MyHigh, uh, Liquid IV, etc. Whatever works for you is good. But you got to be hydrated with electrolytes. Lower torso compression helps to bring blood up to the heart so it can go to the brain, so the brain can function better. So what we'd like you to do is to try compression hose. Ideally, if you can wear it up to your waist, great, but it can be difficult for some patients. So my suggestion is layering. You start with very low compression, and then you can layer more, and the other layers can be lower up the body. For example, light compression to the waist, and then a low to medium compression over that to maybe the thighs or below the knees. What we're trying to do is to squeeze the blood out from the toes upwards like a tube of toothpaste up to the heart, so the heart can then do its job and pump the blood around the body and make the patient feel more energetic and less fatigued, better memory, better brain functioning, etc. Minerals such as magnesium help calm the system down. They also help sleep patterns. So I suggest take some magnesium, especially in the evening. If you're one of those unfortunate folks who gets diarrhea, well, magnesium can worsen that. So you take, if it's taken by mouth, so you actually take it through the skin in the form of a cream or lotion or an Epsom salt bath. The other thing I suggest is omegas. Omega oils help to calm the system and improve neurological function. There's one that I suggest, it's called Cardiamin, but there's, whatever you tolerate, get some omega in. The Cardiamin brings me up to that particular one. I like it because it is being researched to where there's not excessive amount of any ingredient. It's research based, so most people when they're not feeling well will want to go and get a mega vitamin because they think more is better. I would suggest you don't do that because the vitamins in excess can actually cause your autonomic system to malfunction. So the Cardiamin is a great way of getting what you need without excessive amounts, and anyone can use the little discount code. It's called CMC if you want to get it direct from the company. Just call them with that, CMC. The other thing I would recommend is additional vitamin D. The level actually needs to be double of what is considered normal on the lab range. And the reason for that is there's vitamin D receptors throughout the body, the brain, the heart, the kidneys, bones, etc. And when we provide adequate and plentiful vitamin D, many symptoms decrease, including anxiety, pain in the legs, and so on. So these are just suggestions which are all naturals and supplementary. Beyond this, of course, there are medications, and what a lot of patients need is just a little bit of self-titration, meaning the doctor prescribes medication. Usually there's one part which is to kind of help bring the blood pressure up and stabilize it, and another medicine to stop the heart racing and not allowing the blood pressure to become too high. Unfortunately, all these things can happen in one patient at the same time. So we're trying to control how the blood flows to the brain on an even basis. So it's not going up and down like a roller coaster when you measure the pressure. And it can get very confusing because when you read the package inserts or research it on Google, you'll think, well, these two are contradictory drugs. One is raising the pressure, the other one is lowering it, so the doctor is obviously a quack. Well, no, This is actually a way of creating a blood pressure clamp. So we are raising the base pressure, so there's plenty of blood going to the brain all the time, and we're using another drug to hold down excessive surges of blood pressure, which can be caused sometimes when there's hyperadrenergic, meaning too much adrenaline floating around. Of course, this is very tricky and it takes weeks and months, but when we get it eventually to fit the patient's profile, it's awesome. There's no fixed combination. It's a question of individual titration. There are also many other drugs that we use, but that's just the basics. Testing usually involves EKG, monitoring of the heart rate with patch monitors or implanted monitors, an echo. Sometimes we'll do it with a bubble study to make sure there's no residual holes left in the wall dividing the right and the left heart from childhood. Because those little holes sometimes can cause migraines and even mini strokes. So good to know whether you have them or not. A stress test usually helps us see how the heart rate responds to exercise and activity. Sometimes we add an imaging study, especially if the patient is older, just to make sure there's no blockages in the blood vessels. There's also an ultrasound test done on the neck pipes, the carotid arteries, just to make sure there's no blockage or obstructions. And then finally, there's the tilt table test, which has many variations, which are equally confusing to the patient and the doctor. I'll be honest, because it seems that there's no one way of doing it, and everybody has a different way of doing it. So I'll just tell you what I like doing, which is to bring the patient in, and I tell them, please do not take your medications that are helping your autonomic dysfunction, and avoid doing the things I told you, like wearing compression and hydrating, because I want to get a good reading on what is your condition when you are at baseline. And then the test involves laying down and being hooked up to some monitors. We raise the table, and usually we also give some nitroglycerin at the end to really stress the autonomic system, to see if it actually malfunctions to the point where the patient may even feel like they're going to pass out. Excuse me. It's not a pleasant test, and usually I tell patients, please expect not to feel good for at least a day or two, if not longer after, and bring somebody to take you back home, because you may not be able to function so well. Of course, you can always start all the medications, everything straight after. Now, that is for a diagnostic test at the beginning of your journey through the dysautonomia world. If you're already diagnosed, I really don't like to do the test because it's miserable, and it's just enough to know that we've diagnosed it correctly. Some centers will also combine autonomic testing of a more detailed kind, where they check for sweat gland responses, called pseudomotor testing, and also looking for nerve conduction studies and so on, looking for small fiber neuropathy, etc. Those are technically complex, and so usually they have to be referred to a center that actually does that, and a physician who actually does it, so they understand what to make of it. So having said all that, we get back to the office, and now you got all this information. So the doctor has to sit down with the patient and figure out a custom plan. One size does not fit all. And so, one has to have an open mind as to the treatments, because we have patients who can barely tolerate anything, including medications, vitamins and minerals, etc., and others who need massive doses to support their systems. So it's an individual plan, If all else fails, I sometimes will resort to infusions of fluids such as saline, which is a 0.9% sodium chloride solution given periodically straight into the circulation, which seems to benefit some patients and gets them through, um, especially their tough periods when they're having autonomic flares. Of course, the problem is you're tied to a machine for a couple of hours and you may have to keep going to the facility, whether it's the hospital or an infusion center, but that's also a very useful therapy. So I know I've talked a lot and people probably have questions. So uh, I think I will just leave my presentation here, and um, when I've been given all the collective questions and so on, I'll try and give you all a little feedback on specifics. But I appreciate the opportunity to spread the word and hopefully help some of you understand your condition better. Thank you and have a wonderful day.